Hi, I'm Harry Wingfield from the UCF IRB staff. This learning module will take you through what to do when you are doing research outside of UCF or working with team members from outside UCF. It will also teach you what we need to see in order for you to rely on an external IRB. Before we get into external researchers and external IRBs, we need to discuss some basic Huron terms. One small mistake that can create unnecessary frustrations is checking the wrong answer in Huron to the question multi-site or single site. You may be conducting the study at several locations, but this does not necessarily mean it is a multi-site study. Whether the PI is at UCF or at a local hospital, it is still a single-site study if there is only one PI and only one study team. If you and your study team are conducting the study at a UCF health clinic and at an outside local clinic, it is still a single-site study since there is not a PI or a separate study team at the other clinic. If you are doing the study as part of a collaboration with USF and University of Florida, and each site will have its own study team and PI that will report to a lead site, that is a multi-site study. It could be reviewed by each IRB or by one IRB for all sites. There are some exceptions to this if you are working with an investigator at Nemours, Orlando Health, Advent Health, or the VA. I will discuss that later in this module. If it is NIH funded, there will have to be one IRB for all sites. If another IRB will be the IRB for all sites, check External IRB in Huron. If you want UCF IRB to be the IRB for all sites, check the option for that, but contact the IRB office first if you plan to do this before you send your submission in, so that the IRB staff can work with you on setting up the necessary agreements for all sites. If it is not NIH funded, the collaborating sites may decide to let each site get their own IRB approval. Generally, if the study is exempt review or NHSR, not human subjects research, we require that each site gets its own IRB approval. This is called dual review. Check single site. Again, most research with local partner hospitals, Nemours, Orlando Health, Advent Health, and the VA are handled a bit differently, and we will go over that shortly. If you are working on a study that is primarily conducted at Advent Health, Nemours, or Orlando Health, these hospitals may require UCF IRB to rely on their review. We have standing agreements with these three hospitals. For these three hospitals, have the hospital IRB review and approve the study first. Then create an external IRB application in Huron and upload all the documents reviewed by the hospital IRB along with their approval letter. We do not need UCF forms or UCF consent forms. We only need a copy of the documents that the hospital IRB approved. UCF will issue a letter verifying that we will allow the hospital IRB to be the reviewing IRB for the study. IRB Guidance 10 in the IRB library has a wealth of information about working with external IRBs. If you are working with an investigator at one of our local partner hospitals, Nemours, Orlando Health, or Advent Health, their IRB must approve the study before you send the study to the UCF IRB. You will be the PI for these submissions to the UCF IRB. The investigator at the local partner hospital can be your faculty advisor. Check external IRB in your IRB submission. For our records, we need verification of when the study was approved by the partner hospital's IRB. Upload the approval letter from their IRB for this verification. You also need to upload the protocol that was sent to the partner hospital's IRB. If the study is ongoing and you're being added to the study, we will need the initial approval letter and the modification approval if available. If the modification approval is not available yet, we can still approve the Reliance, and you can add the approval as an update when it is available. If the study is ongoing and the approval has been renewed since the initial approval, we need the initial approval letter and the most recent renewal approval letter. If the study is not human subjects research, submit the study to the UCF IRB as a single site study using UCF forms. We do not do reliance on not human subjects research. Do not include the study team members from the partner hospital in your submission information in Huron. They have already been approved by the partner hospital IRB. We only need information about you and about the investigator who will supervise your work. For a complete set of instructions, be sure and see the UCF Frequently Asked Questions document for the institution where you are doing the research. VA research requirements. There is an annotated HRP 250 form just for VA research, and this is to help you complete your submission if your role in the VA study is limited to chart review and data analysis. For any other kinds of research at the VA, you will need to use the HRP 255 or the HRP 255 SR for exempt review, or the HRP 503 for expedited review. There is an annotated HRP 255 and an annotated HRP 503 available in the Huron IRB library under the General tab. Complete these UCF forms based on your role in the study. The Huron submission for VA. Prior to completing your protocol form, HRP 250, 255, HRP 255 SR or 503, in your Huron application under Basic Study Information, question 4, what kind of study is this? Check Single Site Study. UCF IRB is only reviewing your role in the VA hospital study. For question 5, will an external IRB act as the IRB of record for this study? Select No. You are the local principal investigator. The VA investigator can be your faculty advisor. For question 8 in Huron, attach the protocol. Upload the completed UCF protocol form, either the 250, the 255, or the 255 SR, or the 503, based on your role in the study. The annotated HRP 250 for VA is available from the IRB staff. Annotated HRP 255 and annotated HRP 503 are in the Huron IRB library under the General tab. Local study team members would only include the UCF team members for your role in the study and your faculty advisor. We do not need the roster for the VA study team. Under local site documents, we do not need UCF consent forms or UCF recruitment materials. If your study has these, upload the VA approved versions under local site documents, other attachments. Also in other attachments, upload the VA IRB approval for the study and/or the VA IRB approval for the modification that added you to the study. If you want to set up a Reliance agreement with any entity other than Advent Health, Orlando Health, or Nemours, contact the IRB office first. The IRB can guide you through the process of setting up Reliance agreements if that's the best path forward. For these, we will not set up Reliance agreements for exempt or for not human subjects research studies. For these, each IRB will have to do its own review. We only set up new Reliance agreements if the study is expedited review or full board review. If the other site's IRB agrees to be the IRB of record, contact the UCF IRB to provide us with information about that site's IRB, about the study, and about what UCF researchers will be doing. Note that a new Reliance agreement for an external IRB that is not Nemours, Advent Health, or Orlando Health is not guaranteed. We may request a dual review where you will send in a single site UCF IRB submission for your role in the study. The UCF IRB staff will either start the authorization agreement or let you know if each IRB will need to do its own review. Local clinics or practices with no IRB. You may want to conduct a study along with a local clinic, rehab center, or fitness center that does not have its own IRB. We will need a letter of support from the head or director of that facility. Upload that letter into local site documents, other attachments. If there is someone on that site who will also be on your study team and they do not have their own IRB, we can set up an agreement for the UCF IRB to be their IRB for this study. You will first complete and upload the HRP 253 that is a list of all your external team members. Then, depending on their role in the study, the form may direct you to have each of them also submit an HRP 252. There will need to be a separate HRP 252 for each external team member who is engaged in research. If they answer yes to any of the questions on the HRP 253, then they are engaged in research and will need to complete an HRP 252. The HRP 253 should list all the external team members on one form. Each member who is engaged in research will then need to complete an HRP 252. The HRP 253 is the entire list of all the external members. Each HRP 252 is for one individual only. Upload the HRP 253 and any HRP 252 forms into Local Study Team Members, Question 2, External Team Member Information. Also, upload their completion certificate for UCF CITI training if they are completing an HRP 252 for us to be their IRB. If any of the external team members have no checked on all the questions in the HRP 253, you do not need to submit an HRP 252 for them because they are not engaged in research and do not need an individual investigator agreement. If the clinic staff does not help with the consent process and does not have access to identifiable data, they are not engaged in research. And we also do not need CITI training for these. Remember, if their site has its own IRB and they are getting their own IRB approval, you will not need to complete the HRP 253 or the HRP 252 because they have their own IRB. So the UCF IRB does not need to cover them. I will discuss faculty advisors in another slide. More about CITI training. If the external collaborator has their own IRB and will rely on that IRB, we can usually accept CITI training from that site's CITI account and not require additional UCF CITI training. If they do not have their own IRB and will be working under an individual investigator agreement from the UCF IRB, then they must complete UCF-related CITI training. If they've already done CITI training elsewhere, they can add an affiliation with UCF in CITI, and CITI will give them credit for all the modules they have completed and direct them to any additional modules they need for the UCF CITI certificate. Now we're going to talk about who can be the faculty advisor. All College of Medicine student projects must involve a faculty advisor. We have partnerships with Nemours, Orlando Health, and Advent Health. If you are doing your research with their files or their patients and relying on their IRB, your mentor at that hospital can be listed as your faculty advisor. Other mentors can be listed on your study team, but your designated faculty advisor must complete the required faculty advisor review or be an approved faculty advisor already. If your research is at UCF, your faculty advisor must be UCF College of Medicine core faculty or an approved advisor who has access to Workday and who has completed faculty advisor training. Other mentors can be listed on your study team, but your designated faculty advisor must complete the required faculty advisor review. If your research is at an institution other than a partner, the mentor there can complete online faculty advisor training, or you must choose UCF College of Medicine core faculty as your faculty advisor. If they are not core faculty, they can search Workday for IRB Basics for Faculty Advisors for the course. If they do not have access to Workday, then you must choose Dr. Hines for FIRE or Dr. Coffey for FIRE Plus or another College of Medicine core faculty member as your faculty advisor. Your faculty advisor must be listed on your study team. For any projects that will be reviewed by the UCF IRB, your faculty advisor must be up to date on UCF CITI training, just like any other study team member. If your faculty advisor does not show up in Huron when you're trying to add them, contact the IRB by emailing irb@ucf.edu. We may be able to get them added to our system so that you can select them. If we can't, then Dr. Hines will need to be your faculty advisor if this is a FIRE project, and Dr. Coffey will be your advisor for FIRE Plus projects. Your faculty advisor cannot be the PI for your UCF College of Medicine FIRE submission. You are the PI. And here's a question. You are conducting a study at a cancer clinic that does not have an IRB. No one at the clinic is helping with the research. Which of these is true? Choice 1. You will need an HRP 253 to list the clinic staff. Choice 2. You will need an HRP 252 for each individual investigator agreement. Choice 3. This is a multi-site study. Or choice 4. None of the above. The correct answer is 4, none of the above. If no one who works at the clinic is helping with the research, they do not need to be listed as local team members or as external team members. It is not a multi-site study because there is only one PI. And that's the end of Module 7. In the next module, I'll show you some common mistakes and talk about how to prevent them.